role plays, and what we try to achieve is to have the health workers get desk guide, which we've developed. And this has followed available evidence-based guidelines. And the aim really has been to empower the health workers with the skills to appropriately screen for, diagnose, treat, and provide quality follow-up care for patients who've got any of the non-communicable diseases that we've discussed and that have been captured in the text guide.
Good morning, madam. You're welcome. I'm Nurse Bola. You're welcome. See, I'm Mrs. Moses, 42-year-old teacher. Welcome. Okay, you're welcome. You came into the health facility, and when you came in, your blood sugar was checked. Okay, I want to know, do you have any complaints today?
Yes, I do. I've actually noticed that I've been urinating a lot at night for some months. In fact, yesterday I went about 8 times. That's my more than I came today.
Apart from urinating, have you noticed you take a lot of water and you get tired easily?
Yes, exactly. It happens to me.
Okay. And those feelings, those symptoms you are having, and with the test that we did, shows that your blood sugar is high, which means you have what we call diabetes.
Wow.
Do you know what diabetes is?
The only thing I know about diabetes is that my blood sugar is raised. Does it mean I have high blood sugar?
Yes, diabetes is you have high blood sugar, and what it means is that the food you take in, normally the body breaks it down into sugar, but when the body cannot absorb the sugar level in the body is very high, and when it is high for a long time like that, it damages a lot of things in the body. It can damage the eyes, the kidneys, and it can even cause ulcers. That is, you have a wound that doesn't heal on time. Those are some of the things that diabetes causes. Don't be too scared, madam. Let me just explain. It's a chronic condition. What I mean is it's lifelong. We don't have a cure for it, but we have a control. And the control is with lifestyle and with diet. What I mean by lifestyle are things you do day to day. Your eating, your exercise, and all that is what we mean by lifestyle.
So does it mean I'm going to change the way I live my life totally?
You're going to make some adjustments, not a total change, just some adjustments. As I said, the control is with lifestyle and with some medications. The lifestyle starting with your food. You have to make some adjustments in the foods that you eat. You know, I talked about having a high sugar. Most of the foods we eat are high in sugar. The diet you have, like the gari, eba, the apple and co, they're high. So what we want you to do is try and reduce. Whatever quantity you are taking now, you reduce it by half. Just cut it into 2 and fill up your plate with vegetables and eat a lot of fruits on a daily basis. It's going to be a continuum. It's not something you do once. That's in terms of the diet. Do you understand? Do you have any clarifications?
I want to know the kind of fruits that I can eat. You said sugar, but there's some sugary fruits. Can I go ahead and take things like pineapple that are very sugary?
No, there's certain fruits you can't take. Like you said, the sugary pineapples, the watermelons. We want you to take things like grape, bananas, and if you have to eat things like pawpaw, those that are not too ripe, and things like garden eggs, they are available all around us. But the sugary ones we don't want you to take. But we also want you to avoid sugars, things like all this Coke, carbonated drinks, cakes, ice creams. Those ones have a high load of sugar. So we want you to keep away from these ones. And then apart from the diet, in terms of drinks, do you take alcohol?
Yes, I take alcohol.
How much of alcohol do you take?
I enjoy a glass of wine, maybe like 2 nights in a week.
Okay. Do you smoke cigarettes?
No, I don't.
Okay. Do you engage in any form of exercise routinely?
Not at all.
Okay. But this diabetes, is there anyone in your family that you know has diabetes that you are aware of?
Nobody at all. That's why I'm surprised that you're telling me I have diabetes.
Okay. So in line with what I've just talked about, lifestyle, I'm happy you don't take tobacco, but the alcohol you take, you said you take a glass of wine once in a while. I would advise, if you can, to please try and reduce or even totally go off the alcohol, because the quantity you take, I don't know in terms of the amount of alcohol. So if you can, please try and cut off alcohol from your diet. But apart from the diet, the alcohol and the cigarette smoking, in terms of foods that you also take, I want you to try and cut off or reduce the amount of oil in your food, both the red oil, palm oil, and groundnut oil. It should be very small in the food that you eat. And also, because you have diabetes, you are also at risk of coming down with hypertension. So I need you that high blood pressure to cut down on your salt in the foods that you eat also. Because most times people that have this sugar, high sugar, tend to come down with high blood pressure later on. Do you understand?
Yes, I understand. But my blood pressure was taken this morning and it's normal. They said it was normal.
Yes, as I said, it's over time. It's not that it starts now. It's over time. You're at risk. So we don't want you to come down with it. That's why you have to reduce that. So apart from this lifestyle that I've talked about, you need to be careful about your food. You know, I told you that diabetes can affect every part of the body. It can give you wounds that do not heal on time. So to prevent you having wounds, the common place the wounds usually happen is in the legs, in the feet. So please make sure while you're in your home, you're wearing slippers. Your feet are always in a pair of slippers. We don't want you to wear tight-fitting shoes. You know, women like to wear high heels and all that. So you have to make that adjustment and wear shoes that are not too tight, so that you don't develop any wounds because it wouldn't heal on time. Also, please, when you need to cut your nails, please don't use a razor blade. Try and because you can easily injure yourself and causing a wound, and which will not heal on time. Try and use what we call nail cutter to cut. It's better, it makes it neater, and there's a less risk of you injuring yourself. And because of diabetes, I said earlier that it affects the eyes. We'll need to check your eye at least once a year. We'll refer you to the eye clinic so that they can check to be sure that there's no complications. Are you okay with what I've said so far? Any questions?
I wear glasses, so I'm wondering, could it be this diabetes that caused these glasses, or do I still have to keep going to check my glasses? It's the same thing.
Well, it may not be diabetes that is causing the eye check, but you still need to go every year, because apart from you using the glasses, that has other complications that can affect the eye. So we still need you to go at least once a year to check it. And then those foot things, you yourself make sure, even if you cannot look at your feet, let somebody check the feet for you every day. And before you put your legs in any shoe, please make sure you put your hand inside to be sure there's nothing inside, because sometimes there might be nails or needles inside, and because diabetes will make you feel, sometimes you don't feel the sensation on your leg. Even when you put your leg in the shoe, you may not feel it. So you need to always check your shoes at all times to be sure that there's nothing there that can injure your feet at any time. So please, in terms of medication, as I said that sugar was high, so we need to start you on a drug. This drug is lifelong. We'll start today, and you have to take it continuously every day. Yes,
Am I not going to stop taking my drugs?
No, ma, you will not. If you're going to take the drug for life, we will just be adjusting the dose as we see it.
What about bitter leaf? I've heard that if I take bitter leaf, then I block anybody that takes bitter leaf, blood sugar will go down.
No, that's not a true story. It's, as we call it in Nigeria, that's fake news. It will not go down. So you need to stay with what we tell you in the health facility. And please, you take this message. That person that told you about bitter leaf, please try and educate the person that it will not cure diabetes. It will just make it worse. Also, please try and inform your other family members to come and do their check also. Your husband, even your children. But note that your husband does not get it by sharing your bed or eating with the same spoon and all that. It is only transferred maybe from family. A mother can give her unborn child, or is in the family, so it can be transmitted from one member of the family to the other.
That bring them.
Yeah, so that we'll check and tell them all we have told you. Because if one member of the family has diabetes, every other member can have it later on. So we don't want other people to have it. Are you clear on what I've said? Any questions, any clarifications?
I understand what you have said, and I will try my best, because these complications you've talked about, I don't want to have any of them. I'm still very young. I want to live long and healthy.
So finally, before we go, I want to talk about exercise. You know, you said you don't do any routine exercise. So I want you to make it a part of your lifestyle. You're a teacher, I know you have to get to school around 8, but in that time, maybe during the break time, when the children are on the field, you can also walk around the field of the school for 30 minutes every day. It will help. All of this together with the drugs will help to bring down your blood sugar. And please note that you will need to come for checkups often as we advise to see, so that we can monitor the sugar and see how it is going down and know how to adjust your treatment as you see fit.
So when am I coming back for this?
So I'm going to give you an appointment for 3 months. In that 3 months, please try and start this lifestyle, continue your drugs, and when we see you, we'll know what next to do. So I'll give you an appointment, and you go to the records, the book, but I would like to document all that we talked about in your folder, so that when next you come, I can compare the values of what we have today with the next time. So I thank you very much for your time.
Is it possible that I'll see you again when I come next time?
Well, I can't guarantee, but the essence of documenting is that any other doctor that is available will be able to continue from where. But if I am around, you'll see me. Thank you.
Thank you very much.